Hi, I'm Hayley Chidlow, and this is my top tips for approaching an asthma crisis. Equine asthma is characterized by a combination of pulmonary inflammation, bronchoconstriction, and increased mucus production. One of the most common reasons for a call out to a horse in respiratory distress is for an acute asthma flare up, particularly in winter when dust levels are high. And this respiratory distress is primarily due to severe bronchoconstriction. The focus of emergency treatment is therefore firstly to relieve bronchoconstriction and then to reduce inflammation. This video is a pony who had previously been diagnosed with equine asthma but subsequently had a severe crisis despite already being managed with inhaled corticosteroids. So as you can see, this pony had a significantly increased respiratory rate, effort, and respiratory noise. So if we are called out to a case such as this, what drugs do we need in our car in order to effectively treat the acute respiratory distress? The first thing we need to do is cause bronchodilation. So there's several drugs we can use for this. Firstly, we can use beta-2 agonists, so we can use inhaled drugs such as salbutamol or albuterol, particularly if the horse has previously been diagnosed with asthma and the owner already has the spacer device and inhaler. However, if it's a new case, then you may not always have this medication in your car, particularly if you're already out on the road when you receive the call out. You can also use oral clenbuterol, although this doesn't have an immediate onset of action. Alternatively, you can also use injectable clenbuterol if you have it available. However, other options of drugs to use if you don't have a beta-2 agonist include atropine, which is a very potent bronchodilator. But again, if you were already on the road when you receive this call, then you probably won't have any atropine in the car. So finally, the other drug you can use is buscopan, which is in the car of most equine vets. So this is a very rapid action, and normally if you watch the pony for a few minutes after administration, you will see them visibly breathing easier. It does have a short duration of action of only 30 to 60 minutes, but it will ease the respiratory distress long enough to then come up with a plan for ongoing treatment. So the next thing is to reduce lung inflammation. Unfortunately, inhaled steroids are not that effective in these acute severe asthma cases, and so systemic corticosteroids are normally required, of which dexamethasone is the most effective. It can take a few days for full treatment impact to be seen, so I typically recommend starting with a 0.05 to 0.1 mg per kg dose of dexamethasone intravenously or intramuscularly, and then continue this course for a few days to even weeks before transitioning to inhaled corticosteroids once the horse's clinical signs are more under control. Obviously, there is a risk with corticosteroids, particularly in horses and ponies with underlying metabolic issues. And so I would always warn an owner about this. However, overall, the benefit and requirement to treat the severe asthma episode outweighs the risk of laminitis in the majority of cases. Finally, while environmental management isn't going to have an immediate effect in a crisis such as this, it is still important to institute management changes. So, for example, where dust is the main allergen, soaking hay, reducing dust embedding, and increasing turnout time are all important. When an acute crisis is occurring in summer with pollens as the suspected allergen, then stabling can help.